So I want to talk about fat transfer. Fat transfer is something that everybody's heard of. Uh, Putting fat in your butt, putting fat in your breasts, putting fat in your face. These are all areas where fat can be used. The one thing I want to tell you is if you're going to undergo any kind of fat transfer procedure, you need to go to a board certified plastic surgeon. People think this procedure is just a simple procedure to do, but it takes skill and it takes the ability of the surgeon to have a visualization of what they want and a surgeon who's responsible who can take care of you. You need to be aware that not all the fat survives. We know that there's going to be a certain amount of fat loss, so you need to be aware that you may have to do the procedure more than once. The most effective area for fat take is in faces. As we age, our faces become hollow. We know that youthful faces are more full. So when we're doing fat transfer to faces, this is a procedure that can be done either under local, it can be done with you asleep, but it's smaller volumes of fat with a higher degree of take. And yes, you're going to have some bruising and swelling and probably a 4 or 5 day downtime. And that procedure can be used for both men and women. For the breast, we can also use fat transfer. Can you make a huge breast with fat transfer in a woman? No. But you can get modest, very effective changes. Modest changes that when combined with, let's say, a breast lift, can actually, in some situations, diminish the need for an implant. In a man, I use fat transfer when I'm actually removing the male breast in terms of something called gynecomastia or male breast growth, and I take that fat over the lateral breast because a man, we want this to be very thin, and we can add the fat to your pec to make it look like you've actually got a full pec. That works great. Fat transfer to the bottom in women, very popular procedure. We take fat from the abdomen, the back, and use that fat in a subcutaneous plane, not into the muscle. And I would warn you that when you run into problems with fat transfer, it's for muscular injections. We put it in the skin plane to build up shape. And we're going to look at you and decide the shape that we want to get out of it. It's a high patient satisfaction procedure. Yes, sometimes you need to add more volume, and you should know that going in.